healthy. That's your hope for your new baby. But medical issues can arise. So it's good to know there's one place in the region where mother and child can face any challenges under one roof, without separation, and receive care and counseling that are second to none, from delivery to homecoming. Welcome to the Perinatal Program at Penn State Children's Hospital. Your journey starts with labor and delivery. Our focus is on your comfort and preparing for your baby's unique needs from the start.
Hi, I'm Allison Irvin. I'm the perinatal coordinator at the Milton Hershey Medical Center. When you come to the medical center through the main entrance, when you first walk in, there is a help desk. So if you have any questions, there are people who can direct you at that area. You'll walk straight down the main hallway, and eventually you'll see the lion statue in the rotunda area. There's our main cafeteria there with many options for food for yourself and your family. And there are the rotunda elevators you'll notice, and you'll take those to the third floor, which is labor and delivery. When you exit the elevator, the first thing you'll see is the check-in desk with a secretary who can help you sign in and out when you're visiting and provide you with a visitor badge so you can have access to all the labor and delivery and postpartum units. You'll also notice to your right-hand side a family waiting lounge, and that's provided so that you have a comfortable area for family while you're laboring. They can wait outside if you would like less people in the room, and when you're ready, they can come and visit you. There are a few different types of rooms that you may be staying in while you're delivering. The first would be the labor and delivery area. There are 5 rooms. They're quite large to provide you privacy and comfort while you're laboring. And if you do, for any reason, need a cesarean section, there are 2 rooms directly on the floor so that you wouldn't have to travel to another floor. In that same area, there are some triage rooms. Those rooms are used if you may be in labor or if you need to be sent over from the clinic for extended testing for the baby. Those rooms are also private, as well as all of the postpartum rooms are private and have attached bathrooms and an area for your support person to stay with you overnight.
Compassion for your newborn and passion for providing the best treatment. They come together in our neonatal intensive care unit, where small miracles happen every day.
To visit our NICU, when you start in the rotunda where the lion statue is, you would take the south hallway. About halfway down on your left-hand side will be the south elevators, and you'll take those to the 7th floor. When you come off the elevator, the first thing you'll see is the Ronald McDonald waiting area. We provide you 2 spaces where you can relax with your family, an area for eating, if you bring in your lunch, checking your email, and another area where you can sit. There are some toys for your children. You can also relax with a nap if you need to. To gain access to the NICU, you'll find that the doors are locked for security of your baby. There's a phone on the right-hand side of the hallway. You'll just pick that up, someone will answer, and you'll give your baby's last name, as well as the unique 4-digit code that we give you for your baby. At Hershey Medical Center, it's our highest priority to keep your baby safe and healthy, and we recognize that the best way to do that is good hand hygiene for all visitors, including medical staff, to our NICU. So when you first enter the NICU, on the left-hand side, you'll see the scrub room. We just ask that you wash your hands from fingertips to elbows for 2 minutes to ensure the safety and health of your newborn. We understand that every mother has unique preferences for feeding her baby. If you would like to breastfeed, we provide a hospital-grade pump in your room while you're in the hospital after you've given birth. We also have a private pumping room with 2 stalls in the NICU that provides a lot of privacy and comfort, or if you prefer, you can pump at the bedside next to your baby. The feeding journey for each mother and baby is individual, regardless of if the baby needs to be in the NICU or not. But on top of that individual feeding journey, the babies who are in the NICU have extra diagnoses that require special care and treatment. To support you in your breastfeeding journey, and so you feel that you're going home and can be successful in supporting your baby, we have a dedicated lactation consultant that can provide care for you 3 days a week in the NICU, and a group of expert nurses who are wonderful at helping you problem solve and feel confident in breastfeeding. The continuing care nursery is a step-down unit staffed by the NICU nurses and doctors, the same ones who cared for them in the intensive care unit. When your baby's doing better with feeding and growing and preparing to go home, it provides you a space where you can stay overnight and learn all aspects of their care so that you feel confident when you take your baby home.
Some issues call for long-term care and baby steps to complete recovery. Our pediatric intensive care unit has a team of dedicated specialists with the experience and expertise to deliver the best outcomes and the environment to nurture your baby at every step.
All visitors who come to the Children's Hospital will stop at the check-in desk to receive a picture badge for security of all the children in the hospital. It's important to have a visitor badge on at all times when you're visiting your child in the Children's Hospital, as you will pass by a security officer who will allow you entrance to the elevator that will take you to the 4th floor, which is where the Pediatric ICU is housed. When you first exit the elevator, you'll notice the Ronald McDonald waiting area, which will provide a space where you can take a break from the unit or bring in lunch if you'd like to eat there, and a sitting area for family when you're having people come and visit. For your convenience, right outside of the Pediatric ICU are free laundry services that are provided to all families of Children's Hospital patients. This is to be sure that you can be with your child as much as you'd like and that you don't have to go home to pick up clean clothes or have to do your laundry. Like all pediatric floors at the Hershey Medical Center, the PICU is a locked unit for your child's safety. There's a phone outside the entrance that you just need to pick up and say your child's last name and who you are, and the staff inside the unit will let you in to visit your child. Being the parent of a child in the hospital can be stressful and overwhelming. Your child will be given their own room to enhance the healing process and ensure that you are as comfortable as possible during your stay.
Care for your entire family. Who cares for you and your family? Your clinical counselor, an expert to count on, and an advocate for your complete well-being.
Hi, I'm Jennifer Stoner. I'm the clinical counselor for the Perinatal Program. As the clinical counselor, I offer emotional support to our patients that come into our program. It's a holistic care approach for these patients because they are at a time in their lives where they're at very high anxiety and they're learning new information about their baby in utero. When parents come to me and their anxiety is high and they're frustrated with maybe the diagnosis that they've been given, they also think about their other children and how are they going to explain to their children that are thinking this baby is going to come home from the hospital right away. How do they explain that diagnosis to them? So I've been able to meet with these families, give them a tour of where the baby will be staying so that their younger children can see a little bit more about what is expected when they come to visit their brother or sister, mostly in the NICU. And then I also offer a session with the families to be able to describe that, the medical care. I offer books and resources to the child to be able to help them. We're always looking for new ways to improve the patient experience. And in listening to the feedback from our patients, we created this role that I'm now in to be able to provide that emotional support in holistic care for our families. In the Perinatal Program, we're the only one in the region that provides this unique service that takes care of both the baby and the mother in one facility.
Thank you for taking our virtual tour. We welcome you to visit us in person. Please call to schedule an appointment or visit our website first for more information.